Hey guys, Dr. Michael Derry here, and I treat spinal stenosis all the time, and most commonly it's in the lumbar spine. And then today, in particular, I want to talk about lumbar spinal stenosis and the difficulties it can cause while walking. I want to go over a little bit of the signs and symptoms, as well as 3 go-to stretches that I help give my folks to help improve their ability to walk longer and have less lower back and leg pain. Let's go. Okay, so lumbar spinal stenosis occurs in the lumbar spine. You have about 5 vertebrae there that help make up your lumbar spine, and stenosis by definition is a decrease in space, and that those nerves are used to having a certain amount of space around them. They don't have it anymore, and that's what you see in these little yellow marks here, is that the nerves in the lumbar spine give your pain, sensation, muscle strength and reflexes down into your legs. And when you have stenosis, you can have a little bit of a decreased space around those beautiful nerves, causing symptoms in your lower back potentially, but as well in your legs. And so you can have it in one leg or in both legs. But when you have spinal stenosis, the diagnosis is often made by x-rays or MRIs. But in my world, it's made clinically. And in those folks, they have that classic pattern of not being able to walk very long before they have symptoms in their lower back and or leg. And so they will report that they use the grocery cart at the store to help them walk longer and further, or they're always trying to find a bench to sit on, or they're trying to find some way that they can go ahead and flex their spine. And so when you look at the lumbar spine here, you could tell that when we flex it, all of that space in there increases. And so a classic sign and symptom is that you're having leg pain. You sit down, you have a little bit of curvature in your lower back, and those leg symptoms go away. It's almost immediately, which makes it seem really interesting in that you can have a great amount of discomfort in 1 second, but then absolutely no discomfort in another second. And so that's a clinical sign and symptom related to lumbar spinal stenosis. It's one of the great things to treat, and that we want to improve your ability to walk and stand. And that takes some specific treatment and getting to know your body. It absolutely can improve conservatively. But when you're looking at the lumbar spine, the trick is, when you're treating lumbar spinal stenosis, is that you find some techniques that you can help increase that space and improve your ability to stand and walk. Self-management techniques and conservative techniques are the best place to start. And that's what we do in the clinic all the time. So the best conservative treatments that you can do often involve some sort of flexion exercise to help improve that space. And these folks, they report that bending backwards, standing, walking, doing the dishes can cause that lower back pain or symptoms down your leg. And so those are not very fun symptoms to experience. But when they go to sit down, they have immediate relief. And so what we do is we help improve that walking and standing ability by targeted exercises to help improve that lumbar flexion and the nerve irritability, right? And so if we had some mild back pain, that would be much more tolerable than severe leg pain. And so we help improve those signs and symptoms. That's first line treatment for lumbar spinal stenosis. So today, and in just a couple seconds, I want to go over a few stretches that I've seen help a lot of people avoid surgery, injections, but help them manage their symptoms conservatively and immediately improve their ability to stand and walk. Let's go over those right now. All right, so we're gonna go over 3 exercises that Claire and I both love to use when treating lumbar spinal stenosis, and in particular, the difficult ability to walk long distances. And so one of the exercises is called knees to chest. It's pretty simple, but it is very effective to attain that flexion moment in the lumbar spine, which gives those nerves some space. So we're gonna go over that right now. So she's gonna lie on her back. And then when she lies on her back, she can bring both legs up to her chest, and she can use her arms to help her out. And you want to just keep your back nice and relaxed. And so in the clinic, when we treat this, it is not uncommon to see immediate relief in your leg symptoms when you go to sit down, and in particular when you do any type of flexion moment, which could be the knees to chest. And so we want to do this until the leg symptoms either go away or feel 99% better. And then you're able to get up and walk and feel better immediately and walk further. And then if you have symptoms again, you can just sit down and do this exercise again, or lie down. You're more than welcome to do one leg at a time as well. You really just do this when treating lumbar spinal stenosis. You do this in a way that you can do as many as you would like without any increase in symptoms, and you would actually expect a decrease in symptoms as you go. So now we're gonna move on to a seated exercise as well as a standing exercise. Okay, awesome. So now we're moving into the standing exercise. I'm using the table here but you can use a countertop or really anything that you feel comfortable bracing yourself on. Remember, with lumbar spinal stenosis, the walking difficulty comes from the extension in the spine. And so if you're standing and walking, you have more extension, but as soon as you lean forward, you open things up and give yourself that little bit of flexion moment, which will absolutely reduce those leg symptoms. And so what she's doing here is this L stretch or a countertop stretch, some sort of stretch to help stretch that lumbar spine and improve that flexion moment, which open things up. And I'm not joking when I say 99.9% of people with classic lumbar stenosis benefit from this exercise right now, because you could do it anywhere. And if she had a lot of symptoms while walking, she would feel better immediately and can continue walking. There's no damage being done when you're feeling those leg symptoms. You just have to manage them. And now we're gonna go over an even easier exercise when treating the difficulty with walking. Okay, so the last exercise here is the easiest, because classic lumbar spinal stenosis and the difficulty with walking automatically improves when you go to sit down. And so she's just gonna sit here. She's getting that nice lumbar flexion moment. And to kick it up a notch, she would just spread her knees a little bit and then bend forward and try to just reach the ground. And you're gonna see that beautiful lumbar flexion moment here. And if she had lumbar spinal stenosis, she would be in love with me right now, because this helps symptoms right away. And 9 times out of 10, people have already found this out, because when they sit down, they feel a lot better. So when you combine the standing stretch, the knees, the chest, and then the seated lumbar flexion, these are great ways to help manage difficulties with walking when you have lumbar spinal stenosis. Now, the dosage and the reps and sets, I'll put in the description, just because it's good to have a good number to start with, but that number changes for everybody. And if you guys like the information we're putting out there, please subscribe to the channel. Just support us and we can move forward with just putting awesome information out there. And hope you guys just stay healthy, keep moving, and take care of yourself.